Hello, everybody, and welcome back to the Mindful Matters podcast. I'm your host, Shireen Bhutani, and today we're going to be talking about HIV and Hep C prevention. Thank you for joining us today, and let's dive in. So, here's the truth. HIV prevention works. Hepatitis C is often curable, and AIDS is not a mystery word, it's a stage that we can prevent. But some cities and regions are still carrying an unfair share of infections, not because people don't care, but because access, stigma, poverty, and health systems don't hit everyone equally. Today, we're talking about the tools that work and why places like New Orleans and Memphis are a key part of the prevention story. So let's just set the table with some quick definitions so we're all on the same page. First, HIV is a virus that attacks the immune system. AIDS isn't a separate virus. It's a diagnosis that can happen when HIV has damaged the immune system significantly, or certain infections appear. Preventing AIDS is largely about preventing HIV and treating HIV early and consistently. Hepatitis C, also known as Hep C, is a virus that mainly affects the liver. It's most commonly spread through blood to blood contact, and today, treatment can cure most people. Another important note, prevention is not just personal responsibility. It's also about whether your community has testing, clinics, affordable meds, stigma free care, and harm reduction services. So, how is HIV transmitted? And let's go over like a prevention toolbox that everyone should have. HIV is transmitted through certain bodily fluids, most commonly through sex without protection when one partner has transmissible HIV and through sharing injection equipment. It is not spread by hugging, sharing food, toilet seats, or casual contact. Now, let's go through the tools. Think of this as a layered defense. First, let's set the foundation testing. Knowing your status is prevention. If you're negative, testing helps you stay negative. If you're positive, testing is the gateway to treatment, and treatment protects you and your partners. Second, PrEP, prevention before exposure. PrEP is medicine that reduces the chances of getting HIV. And here's a key shift. CDC guidance says clinicians should prescribe PrEP to anyone who asks for it, even if they don't report specific risk factors. Third, PEP, prevention after possible exposure. This is when you should be in emergency mode. PEP must be started within 72 hours after a possible exposure, and the sooner the better. Fourth, condoms and STI care. Condoms still matter, especially because STIs can increase HIV risk, and condoms protect against many infections. Lastly, and probably the most important, treatment as prevention. U equals U. What does that mean? The message U equals U is undetectable equals untransmittable. And that is huge. When someone with HIV is on treatment and stays undetectable, there is effectively zero risk of sexually transmitting HIV. U equals U is one of the most hopeful public health messages we have. So, we just talked about HIV and AIDS. Now I want to dive into the basics for hepatitis C and prevention, and a little bit of why they overlap. Hep C is different from HIV in a few key ways. Hep C is primarily bloodborne. The biggest risk is sharing needles or other injection equipment, but also anything that can transfer blood, like unregulated tattoo equipment or shared drug use supplies that cause cuts. Hep C can be silent for years, so screening matters. The CDC recommends universal Hep C screening for all adults 18 plus and during each pregnancy. So, let's go through some Hep C prevention steps. First, using sterile injection equipment and don't share supplies. Getting tested regularly, especially if you've ever injected drugs, even once, or had other blood exposure risks. If you're diagnosed, get treated. Curing Hep C prevents liver disease and helps stop transmission. So, why do HIV and Hep C get discussed together? Well, they overlap in communities affected by injection drug use, and co-infection can complicate health outcomes. So integrated testing and care is the smartest approach. So now that we've gone over some basic definitions for HIV, AIDS, Hep C, and basic prevention strategies, let's talk about why some cities are struggling more and what factors are causing this. So the federal Ending the HIV Epidemic, the EHE initiative, focuses resources on 50 priority areas. That includes Washington, D.C., and San Juan, because more than half of new HIV diagnoses occur there. And you can read about that on the CDC website, which I will link down below. You'll recognize many as major metros, Miami-Dade, parts of Atlanta, Houston County, Baltimore City, and Orleans Parish in Louisiana. So, why are these cities struggling? Are we seeing a few recurring themes between them? And the answer is yes. The recurring themes are first, a stigma that keeps people from testing or asking for PrEP, clinics that are hard to reach because of hours, transportation, childcare, costs, housing instability and poverty, gaps in sexual health education, and lastly, substance use epidemics without enough harm reduction and treatment access. These are some of the recurring themes we're seeing in these affected areas. So I kind of want to now spotlight and zone in on one city in particular, Memphis, which is the most affected metro currently, and what we can also do about it. So, according to the CDC's 2023 HIV surveillance report tables, the Memphis, Tennessee metropolitan area had the highest HIV diagnosis rate in 2023, 31.4 diagnoses per 100,000, ranked number one amongst metros listed in that table. And this will also be linked below, which you can read about on the CDC website. And the important thing is it's not just a stat, it's a signal. Memphis is exactly the kind of place where expanding the prevention toolbox can create outsized impact. So why are cities like Memphis struggling? First of all, we don't blame the people when a city is hit hard, because it's rarely that the people don't care. It's the system. It's usually a mix of barriers to care, like the transportation, insurance gaps, stigmas that delay testing or PrEP. As we've seen in the recurring themes, housing instability, poverty, and gaps in access to primary care. And lastly, substance use challenges without enough harm reduction infrastructure. Like I said, those main key recurring themes are hitting a city like Memphis the hardest. So, what do we do next? I'm going to go through a Memphis specific action plan, but this is able to be applied generally to any of these affected areas. First, let's talk about how we can make prevention practical and local. And that starts by making PrEP and PEP frictionless, same day if possible. The Shelby County Health Department explicitly provides both PrEP and PEP, including navigation support. If you're listening in Memphis and you want PrEP, or if you think you need PEP, there are local public health pathways to get it. And that doesn't even apply to just Memphis. It applies to anyone living in a affected community, or if you think you need PrEP or PEP. Now, secondly, normalizing free fast testing. The Shelby County Health Department advertises free HIV testing with posted hours and locations, plus community sites. You can read about it on their website, but not just Shelby County Health Department. Your local health department will also have this information on their website with their hours and services. I'm sure you can find it all there. It's very accessible information. Testing shouldn't feel like a big dramatic moment. It should feel like checking your blood pressure, something routine. And being proactive about it is the best way to prevent this epidemic. Third, treat HIV fast, support retention, and reinforce U equals U. Treatment isn't only about individual health. Viral suppression is prevention. Undetectable means no sexual transmission risk. That message reduces fear and increases engagement. Also, pairing HIV prevention with Hep C prevention. Even though I know this episode's titled HIV plus Hep C, the prevention overlap is real. Blood safety, sterile supplies, and fast linkage to care are real key things that will help us treat this epidemic. Fifth, let's fund community-led coordination, not just campaigns. It's not just enough that I'm here talking about this on the podcast, trying to spread awareness. The real work happens within your community. And for example, in Memphis, they have a coordinated local effort. It's called End HIV 901, aimed at driving new infections down dramatically by 2030. That's the kind of local coalition that matters because prevention works best when it's built within the community. Lastly, naming the city goal clearly. Fewer new infections plus fewer late diagnoses. Shelby County is recognized as a priority area in the national Ending the HIV Epidemic effort, which is designed to focus resources where the epidemic is most concentrated. So, whether you're listening in Memphis or anywhere else, the formula is the same: test, prep, PEP, treat early, keep people in care, and reduce stigma. That's how cities move from most affected to most improved. So now that I've gone over some of the definitions, prevention toolbox, and we zoned in on recurring themes in cities and specifically a city like Memphis and what we can do about it, now I want to kind of dive through some mythbusters, kind of knock out some of these common misconceptions that people have of HIV and Hep C. So let's start with the first one. If I feel fine, I don't need testing. That's false. HIV and Hep C can be silent for years. Second, PrEP is only for certain kinds of people. No, that's also false. PrEP is about situations, and CDC notes it can be prescribed to anyone who asks. Third, if someone has HIV, they're automatically contagious. That one's not necessarily true because if they're undetectable, remember, U equals U. Undetectable equals untransmissible. It's a big key takeaway. Lastly, PEP can wait. No, that's also false. It has to be done within the first 72 hours. So here's the simplest takeaway. If you're an individual, know your status. That means getting screened for HIV and Hep C. If you want extra protection, ask about PrEP. The information's there. It's all over the CDC's website and it's linked below as well. If you think you had an exposure, seek PEP immediately within the first 72 hours. If you're living with HIV, treatment protects your health and prevents sexual transmission. Remember, U equals U, a huge takeaway. If you're diagnosed with Hep C, pursue curative treatment. This is also prevention. If you're part of an affected community, remember to support local clinics, sex education, harm reduction, and programs that make care easy, because that's how we actually drive numbers down. So, to wrap things up, prevention isn't about blame, it's about tools, access, and dignity. Cities like New Orleans are full of people doing the work: patients, clinicians, outreach teams, educators. And the more we normalize testing and prevention, the closer we get to ending new infections. If this episode helped, share it with one person who might need it. And if you're in Memphis or a local affected community, check out the Shelby Health Department or your local health department or clinics that provide PrEP, PEP, and Hep C services. Thank you for joining in today, and I hope you have a wonderful rest of your day.